بسم الله الرحمن الرحيم. قد عمرك انت؟
فوق ال50.
This patient is 55 years old. He have diabetes for more than 25 years and hypertension. And the hypertension is so severe, uncontrolled. He is on no regular treatment. He is complaining of cough, irritative cough, for the last few weeks with a shortness of breath. We examined the cardiovascular system of this patient. Inspection of this patient is show that he got a gynecomastia. And to confirm the diagnosis of gynecomastia, apart from fat or from obesity, we have to palpate what? The breast. If it is breast tissue, therefore it is gynecomastia. If it is fat, this is due to obesity. This gynecomastia can occur with heart failure due to drug like digoxins, spironolactone, diuretics, can cause it. Okay. First of all, we examine the epic speed of this patient. On palpation, inspection, we have shape of the chest, we have the pulsation, epic speed pulsation, not visible here, suprasternal pulsation, epigastric pulsation, carotid pulsations, and the JVP. And the other three, the other part, which of the inspection is extra cardiac examination. We look for a clubbing and we look for cyanosis. We look for there is a slight clubbing where he is slightly cyanosed, and we look for ankle edema. Did he have ankle edema inspection? There is no ankle edema on inspection. Okay. Now we go to we go to palpation. First of all, we palpate the epic speed. epic speed. We palpate the epic speed. Epic speed is the lowermost, outermost cardiac impulse. We have three types of epic speed. We have the normal epic speed. It should be in the normal place, in the fifth intercostal space, within the mid-clavicular line, and from the mid-sternum to the epic speed must not more than 8 to 10 centimeters. And when I put my finger on it, it doesn't lift my finger. This is the normal epic speed. While this patient, the epic speed is here. We measure it, and it was 16 centimeters away from the mid-sternum. It is lifting my finger. When I put it, it lifts my finger. Therefore, it is a thrusting epic speed. This epic speed is displaced and it's thrusting. Therefore, it is a volume overload type of epic speed. If the epic speed is thrusting or heaving or lifting my finger and within the mid-clavicular line, I mean here, it is pressure overload epic speed due to severe hypertension or aortic stenosis. While if it is placed as in this patient, probably due to heart failure and mitral incompetence and aortic incompetence. Okay, this is palpation. We have 6 things in palpation of the cardiovascular system. palpation of the apex beat, and we look for a thrill. There is no thrill, and we look for the parasternal heave if the disease on the right side of the heart. Pulmonary hypertension causing heart failure, pulmonary stenosis, you get heave. The third apex beat is called tapping apex beat. Tapping apex beat is an apex beat which is diffuse, and it doesn't lift my finger, and caused by what? Caused by right ventricle. That we have three types of apex beat. Two causes by left apex of the left ventricle, and the other one is called tapping, caused by what? Right ventricle. If there is right ventricular hypertrophy, whatever the cause, this is the normal heart. It's just like my fist, and this is the apex of the heart. It's formed by the left ventricle, while the right ventricle is being pushed down to the back of the chest. If the right ventricle getting more hypertrophy, it will push the left ventricle down. It will push the left ventricle down to the back of the heart, and the right ventricle come near what? To the surface. And we get a diffuse apex beat, and it doesn't lift my finger. Okay? The second thing of the palpation of this patient is, we said apex beat, parasternal heave, and thrill. And the other things in the outside, extra cardiac, هي البulse والankle edema والperipheral pulsation and JVP. The pulse of this patient, this is the way to examine the pulse. This is the best way to examine the pulse. Put your left hand on the cubital fossa, and the other right hand on what? On the radial artery. This is the radial artery, and this is the ulnar artery, and there is an arch in between them. And we look for volume, we look for character, and we look for rate. Okay? Volume, character, and we look for the rate. And this patient got in tachycardia and a small volume, not that large. And it is not regular. Probably this is due to extrasystole, ventricular systole, or atrial fibrillation. We look later on for that. Now, we look for the JVP of this patient. This is the way to examine the JVP, as we said in our lecture. This is the sternal head of the sternomastoid, and this is the clavicular head, and this is the external jugular vein. Actually, we don't take external jugular vein. We look for the internal jugular vein, and the pulsation is there. The venous pulsation is there. The full pulsation, no? The pulsation. Just behind the mandible. If we measure this behind the mandible, it is wrong. We have to sit the patient. اقعد بالله بالحجي. And now we look for the JVP while the patient is sitting. تشوفون يمكن هنا شوفوا لي هنا وين بشوفه. Yes, it is now here. The JVP here. يلا خليه هو حتى. The measuring of the JVP while the patient is sitting. طين المسطرة طويلة. This is the way to measure it. Put it here and direct to the angle of Lewis. And it was 18 centimeters. The JVP is 18 centimeter water. It means a high JVP. Okay, therefore this patient got a high JVB, and we said that JVB elevated in which condition? Cardiac and non-cardiac. This patient got a cardiac problem, and he got an elevated JVB, and most probably elevated JVB. This is due to congestive heart failure. He got diabetes, he got ischemia, he got severe hypertension. Both of these diseases can cause what? Heart failure. Then we examine the back of the patient to see whether he got anything. خد نفس وطي نفس حيل. 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 حيل بعد. I hear crepitation bilaterally, more on the right side. A fine crepitation. قح بالله قح. نعم قح. هسه خد نفس. The crepitation is not changing. It doesn't disappear. Therefore, it is what? Fine crepitation. What are the causes of fine crepitation in the back? Pulmonary edema, heart failure,
pneumonia,
bilateral pneumonia. Pleural effusion must be bilateral and moderate to severe to causing collapsing of the lower lobe of lung, both lung, and causing signs of crepitation and pneumonia signs like pleural effusion. Bilateral crepitation on the back. Other causes: idiopathic pulmonary fibrosis, fibrosis alveolitis can cause bilateral crepitation seen in bronchiectasis, widespread bronchitis in the left and the right, but this is usually coarse. Bilateral crepitation can be seen in chronic bronchitis. Chronic bronchitis, it is chronic obstructive airway disease. The pressure in this patient was 200/110. It means that he got a severe hypertension, okay, and uncontrolled diabetes. Any questions? Thank you.